As COVID-19 continued its global spread, the U.S. has declared a state of emergency. Europe struggles to cope, and China faces a new threat of inflow from outside the country. So where are we in terms of the coronavirus fighting, and what are the best practices for protection? What action is needed to ensure the virus is ultimately defeated, as with little harm to the affected populations as possible? In the first part of our program, I'm joined via satellite by Dr. Wang Eyao, instructor in medicine in the Division of Pulmonary and Critical Care Medicine at Washington University in St. Louis, and via Skype by Professor Carlos Del Rio, Executive Associate Dean of Emory University School of Medicine in Atlanta. In the second half, I'll be joined by Professor Qiang Yang from the Computer Science and Engineering Department at Hong Kong University of Science and Technology in Hong Kong. That is our topic. This is Dialogue. I'm Zhou Yue. So let me start with you, Dr. Wang. The U.S. CDC has been saying this is America expecting COVID-19 to spread at community level, and disruption to everyday life may be severe. How disruptive this might be in the U.S.?
Yes, clearly the U.S. has entered into the community transmission stage. This means more and more COVID-19 cases are not from outside some epidemic regions, but were infected within the certain small local communities. It is almost impossible to figure out where and how the infection happened and to cut the transmission. Therefore, at this stage, more aggressive and more stringent strategies are needed to implement in the community. And actually, U.S. has been implemented several strategies. For example, the international travel restrictions are effective, and the mass gatherings are canceled, and most of the schools have been closed at this moment.
And Carlos, do you think the travel ban between Europe and America might stem the flow of the spread to the States?
Currently, most of the spread that we're seeing, a lot of the spread that we're seeing in the U.S. is now local, and I think what we have right now in the U.S., I think about it as multiple Wuhans. We have several focus around the country in which community transmission is already spread, is already occurring. So significant measures are needed, and we need to be very aggressive with a mitigation phase. Social distancing is going to be critical right now. We need to really enforce this, because we're not going to stop the spread just by having people not come in. The spread is already happening here inside the country. So therefore, there's an urgent need to stop transmission locally, not worry so much about people coming in.
But it seems different people from different countries have different ideas what social distancing means. There's lockdown in Wuhan, there's now lockdown in Italy and Spain, but they haven't been working the same way. Why the Europeans couldn't stop the spread drastically with their lockdown?
That's a good question. I don't know. That's a really good question. I really don't know. I think if you implement a lockdown the way it's supposed to be, it's going to work. It's a little bit like thinking of isolation and quarantine. It will work if you do it appropriately. So I think in order to do this well, you have to identify the infected. And once you identify the infected, you have to isolate the infected. China did that very effectively. If you can test people, find the positive, but if you have a positive inside a family, then you're going to have, even though you have lockdown, you're still going to have transmission.
Mm. And talking about identification, Dr. Wang, what about the virus testing capability in the U.S.? We understand that quarantine is key only when you know who got infected, but it seems the U.S. is still catching up with testing kits.
Yeah, absolutely. Unable to provide the virus testing to the suspected cases is become the major bottleneck for the U.S. to control the outbreak. But this is like several reasons underlying this problem, political reasons, technical questions. But right now, U.S. has been rapidly scaling up the testing capacity. We expect to see a big improvement very soon in not only the testing coverage and also the testing speed.
So is it still
But
the federal agencies, CDC labs are taking the bulk of the work of testing those samples, or is it that private companies also joining force?
Yes, at first only CDC labs and several national labs can do the test. But right now they give the permission to more like private labs and the institute labs. So now we expect to see like expanding, a very quick expanding of the testing capacities. But compared to the China's testing methods, I think China is more doing like more aggressive, multi-level, multi-method screening methods. For example, we have the temperature taken everywhere. This is like more aggressively to screen for the cases. Compared to China, I think U.S. strategies are more passive. It's like relatively passive. They can only test those who actively seek the COVID-19 testing. So this method may miss a lot of cases, especially those with mild symptoms. I think this is a like big concern because this missed population can spread viruses without any strict restrictions. So therefore, I think this population may delay or even fail the containment of virus in the U.S.
And to follow up on what Liyao just said, Carlos, how more aggressive can America be? Because President Trump has already declared a state of emergency in the U.S., but what exactly does that mean? Does it mean that more people will be living in quarantine, canceling of any public gatherings?
I think the U.S. can do a lot more. The problem we have in the U.S. is that public health is not run at the central level, but it's run at the state and local level. So you have some states already doing things and some states not. I think what the president has to do is he has to call on all the governors to simultaneously implement measures, because if you have one state declaring a state of emergency but another state not, then you have very mixed messages and very different plans, and that's not working. We need a national strategy, and that requires the leadership to take those bold moves. So the president has to bring all the governors, and everybody has to agree that this is the right thing to do. There's a lot more that can be done. We really have many, many things to do, and I think it's really important that actions be taken quickly. We cannot wait. We need much more testing, and I think that was explained fairly well before. We need identification and isolation of those infected, and we need preparing our medical services, and because for the influx of patients we're going to have. And finally, we need social distancing. Those are the 4 key strategies that need to be implemented, and we have to have real social distancing. We have to have what I call, like what China did, a national, we need to have a lockdown. We cannot have, schools are closing but bars are not, or restaurants are not, because then that's not a lockdown. That's not social distancing. That's just moving places of contagion from one place to another.
But what is baffling is that you Americans have been watching this for 2 months, what has happened in Wuhan and now in Europe. Why the people are still not so much aware of this? We saw the airports in Americas in the past weekend, thousands of people arriving in the U.S. They are packed together, waiting in long lines. What happened?
Very good question. I don't know. I mean, I don't know. There's still people saying, oh, this is not serious, this is not going to happen. I think we all of us, and I've been saying in my Twitter account, we have to have a response, and we are way behind, and I am baffled by people still thinking that maybe nothing is going to happen.
And Dr. Wang, medically, what do you think America and the medical institutions should be doing right now to minimize the impact if this is go big?
I think the urgent issue for the medical institute is to coordinate and to allocate the resources to try to avoid the straining of the medical resources. Like in the federal government level and the state level, we should take the possible measures to delay the virus spread, and also that way we can maybe delay and flatten the disease peak. That will help the hospital to prepare for the resources and treat the severe cases.
And there are some reports that actually America is still lacking in terms of ICU units, in terms of respirators, although there might be strategic storage there. But do you think the U.S. can learn from China's experience by setting up some special facilities in terms of a spike of patients anywhere?
To my knowledge, I don't think U.S. has this capacity. And to be honest, I think no countries in the world have capacity to prepare for this pandemic previously. But China promptly act very quickly. But U.S., I think right now we haven't had this capacity to receive or like to accept most of the patients. For example, in China, we not only have the Huoshenshan, Leishenshan Hospital, we also have the Fangcang. This is a makeshift hospitals to quarantine people. Here in U.S., we lack this kind of quarantine hospitals. This is a very important stage, and I think we totally lack this like stage of quarantine. This is very dangerous because right now, if your test result comes back positive, you still go home and do self-quarantine at home. And it's very tricky and challenging to most people and the families, because according to the Wuhan's experience, we know we have seen a lot of familial clusters of COVID-19, and we have learned that the virus can be transmitted easily among the family members.
Yeah.
Right now, we put the cases still within the family. It's very dangerous. I think it's urgent to have effective quarantine methods in U.S., not only for the ICU use, but also for like just to quarantine and to monitor the cases.
And Carlos, in terms of communicating, China obviously have a lot of experiences and also learners' lessons in terms of how to treat those patients, how to allocate resources. But do you think the China-U.S. cooperation in this front is helpful for Americans?
I think it is. I have been in touch with many of my Chinese colleagues all along. I think we have a lot to learn from each other. I've been in touch with colleagues in France, in Germany, in Switzerland. I think there's a lot of learning to be done. And I think in this era of social media, there's a lot of learning that can be disseminated very quickly that we can all learn from. So I am hopeful that if there's one good thing out of this coronavirus outbreak, is that we will have better international cooperation. This is not, we need to think about, not about countries and borders. We have to think about a global response.
Another thing, there's the infection of medical staff. That used to be a big problem for Wuhan in the beginning. 3,000 medical staff were infected, but after people began to realize the problem, the severity, and then they're better protected, and all the 40,000 medical staff sent from elsewhere to Wuhan haven't been infected. But the infection of medical staff is still a big problem to any country's health system. Is America ready to protect its medical staff well? Carlos?
You know, I don't think we're totally ready because we don't have enough what we call personal protective equipment. And we also have not necessarily trained all the people that we need to train on how to well use personal protective equipment. But I do think that there's a big focus on trying to prevent infection of medical personnel. And my hospital and my institution and many places are doing that very actively. But we have to recognize that even with active, even doing this well, we will still see infections of medical personnel. Because the reality is the problem is not the patients you already diagnosed. The problem is the patients you don't know have it. And those are the ones that you're not taking protection from.
And Dr. Wang, what do you know about the medical staff's preparedness?
To my understanding, I agree with Dr. caller's opinion, I think they haven't get prepared very well to receive the patients. And for suspected cases in the hospital, they may not get protected enough for the medical staff. I think at this part, we need to definitely reinforce some policies. And also the face masks is a problem. I know some hospitals are in shortage of these face masks, the necessary protection tools. So I think this is an urgent problem here.
But this happened actually in early January, and it took China by surprise, but still China used just 2 weeks to mobilize the entire manufacturing line to come up with more supplies and medical resources. America had much more time to be prepared. Why America is still not ready?
I would say because we, think about, go back even a month from now and see how the president was still not accepting that this was going to be a problem. I think it just, I will use one word, denial.
So you're saying the lack of leadership, of expertise in this area is preventing America to get the job done?
I think it was many problems. It's not just one problem. This is a little bit like medical errors. There were multiple problems happening. And as I said, I think errors are getting corrected, and now we're taking it seriously. But we are, what do you want, 4 to 6 weeks behind where we should be?
Yep. So next step.
To follow up this question,
yes, Dr. Wang?
Yeah. So I think there are 2 reasons. The first is, like you said, we lack global leaders on this kind of pandemic, and we lack trust among the countries to cooperate on this. And the second reason, I think, a lot of countries judge this, the COVID-19 at previous stage. They think their judgment are based on SARS. So therefore, they are more thinking this is epidemic, not the potentially pandemic problem. I think these 2 reasons may cause the situation right now.
And Dr. Wang, going down the road, if community spread is still happening, do you think America might practice the stringent measures like lockdowns and massive quarantines like China did, like Europe did? And what kind of changes will that bring to America?
I think it's very hard to practice the lockdown and the ordered or forced isolation or quarantine in U.S. because this is not only a legal problem but also ethical problem, or you need to consider a lot of different people's situations. Another thing is, I think after the declaration of the national emergency in U.S., this declaration will empower the federal government and the states and the hospital to give them more power to respond to the virus and the hospital. I hope the state public health agencies can take action. They can enforce the use of isolation and the quarantine based on the scientific evidence, because we know the COVID-19 can be highly contagious because of the close contact. I hope the states can take this action.
But Carlos, nobody wants to have a self-quarantine. The Europeans didn't want that, but they were forced to do that. Otherwise, the hospitals would be overwhelmed and the whole system would collapse.
I agree. We have to do it. And as Dr. Wang said, I think we need to get all the states to agree to do it. We have to have now a national lockdown. We have to have now ways to enforce this. But again, it's going to be really critical that we start testing massively right now. And it's going to happen. It's starting to happen. But if we don't start testing massively, it's really hard to know who to quarantine and who to isolate and what to do. So the reality is, we are right now, because of the lack of testing at the levels we should have, we are a little bit like navigating without a map, right? We are navigating without coordinates. We can't follow. We don't know how to follow the stars. We need to have the testing in order to identify the people.
Yeah.
But I am confident that as much as we have been behind in the response in the U.S., I am very. I feel much better knowing who now is running the national response, and to have Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Disease, to have Dr. Deborah Birx, who is you know, the director of the PEPFAR program, who has run a global program of many billions of dollars, and to have Admiral Brent Gerard, who is really somebody that I have a lot of respect for, who can get things done. I think that is really a superstar team, and if they're allowed to do what they need to do, what they are recommending, and the White House accepts what they're saying, their leadership is going to be critical to get out of this. So I am positive that we will be moving forward, but as I said before, we've wasted a lot of time, and there's no excuse for that.
And that means we need stronger leadership, because facing unknown, navigating without map is a dangerous thing. Thank you very much, Carlos, and thank you, Loyal. You're watching Dialogue here on CGTN. We'll be right back after this. Well, the new infection cases in China is going down dramatically, but now China is facing another challenge. That is the inflow of cases from elsewhere. So what are the dangers? What are the best protections? Let's talk to Professor Yang Qiang, Computer Science and Engineering Department of Hong Kong University of Science and Technology. So, Professor Yang, what do you think might be the dangers of those cases coming from the rest of the world infecting Chinese, who is right now in good control of new cases?
Yes, we have seen such examples of such cases at the border, at the airports, and that is indeed a very worrying fact. To begin with, now we know that the world is a connected world. The inflow of people and the exchange of people is a fact. I think the best way to prevent the inflow of cases is to open up more information, to be more open, to have a more even ground for technology. So, for example, in China, using technology to control the virus spread has gained great success. But such technology may not be available in many other parts of the world. So I think the exchange of information and technology to help other parts to gain the same level of the monitoring and control of the virus spread is critical.
Can you explain in details how those data technologies and artificial intelligence technologies can help us identify those cases or suspected cases and monitor the evolution of the disease in the wider society?
Right. Many scientists in China have started right away to work on the using, for example, big data technology and AI to address the problem. One example is to use the epidemic spreading model in order to quickly decide how widespread and how severe the situation is, the speed, the intensity, the area of infection. There are well-established mathematical models combined with machine learning and big data to help us predict the spread of the disease. At the individual level, so we have AI technologies to use computer vision, for example, use cameras to look at people and use infrared spectrum to detect the temperature, and so to spot the high temperature crowd, and in order to give pre-warning. And there are many other technologies using AI to track the spread of the disease, which are very, very useful.
And here in China, there's a widespread use of personal data to assess your danger of exposure. That data will tell where you've been, who you've been in contact with, and for how long. Do you think those kind of personal data should be used by technology companies and even the government to keep an eye on the epidemic spread?
Right. With the news of the spread coming out each day, I think people are very natural to be nervous and feel very uptight. People don't know whether they are at risk. And so to address this, the best solution is to offer more information, to open up more information. And one source of this information is actually available with many other agencies, such as private enterprises and government agencies. And this is what we call big data. Big data are many, many different data sources. When they are effectively combined, they can give you a really good picture and assessment of your risk. So for example, in China, the telecom operators have combined and built a search engine to allow people to come online and check whether they have been in close contact with those who are infected. And therefore, they can decide whether they want to be tested or they want to self-quarantine. I think methods like this are very, very useful.
But that always raised the issue of protection of privacy, because probably in this desperate time, the protection of private data has been given a backseat. Do you think it should be like that?
In fact, we are growing to be more aware of the ethical issues and privacy issues. Data privacy and artificial intelligence and big data have grown to be a very hot area in the academic world. People are trying to come up with solutions that can, on one hand, offer better prediction and assessment of the situation using more data. On the other hand, offer more protection of user privacy. So we have technologies which we are championing in WeBank, in an internet bank in China. It's called federated machine learning. Another technology people are using
Mr. Yang, I'm sorry, I have to cut you off there. We're running out of time. Thank you very much. You've been watching Dialogue here on CGTN. I'm Joe in Beijing. Goodbye for now.